It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi there again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that are changing people's lives.
Exactly right, Candace. This is the place to come to find doctors that may help your needs. Also, as Candace said, this is about a show about doctors helping change people's lives. Like our first doctor, it's OB/GYN, Dr. Patrick Allen.
Have been living kind of with daily headaches for 13 to 14 years probably. I have done all kinds of different hormone therapy throughout the years, just trying to help my headaches and energy level, sublingual drops, compound pharmacy type stuff, and seen different doctors, and had been driving back and forth to Austin for years. And a lot of it I knew was hormone related, and a lot of it allergy related.
Pellet therapy's been around over 30 years. This is bioidentical estrogen and testosterone, and you think, well, what is bioidentical? Bioidentical means it's exactly what your body makes. It's not derivative, it's not a synthetic, it's what your body already makes.
They draw blood work, and that takes about a week, and then you come back in and he inserts the pellet into your hip, and it's about, he says, the size of about rice. Depends on how much you need as to how many go in at one time.
The pellets in the females, they last for 3 to 4 months. The pellets in the males, they last for 5 to 6 months. They dissolve as you use them up. Now, how long they last depends on your cardiac output. So if you're super active, they may not last quite as long. If you're a little more sedentary, they may last a little bit longer.
Very simple procedure, just deaden that area in his office. It's an outpatient thing. I mean, it just feels like just maybe a little sting going in. That was about it. And you wear a bandage for, I think it was like 5 or 6 days, and you can't swim and get it, extremely wet like that. But other than that, it's just a little bit of soreness, and within 3 to 4 days, really being able to tell the difference.
By not taking a synthetic estrogen for women, it doesn't go through the liver, so you don't have quite the effect on lipids, and you have more reproducible, constant levels of estrogen.
I tried so many things before that it was kind of like, oh yeah, I'll try anything to feel better, just to feel more like myself again. The difference for me was just knowing this could last anywhere from 3 to 6 months, and I'm not having to remember to put a cream on every day or take a pill every day or something like that. It's done. You can forget about it and just feel great and go on and not remember to do something every day. I just feel like I'm not as tense all the time since I've started this.
Denise's passion is tending to her show dogs, but had trouble doing that due to chronic pain in her hands until she met Dr. Traum. To find out more about Denise's story and other life-changing stories, log on to bestdocsnetwork.com.
Neck pain due to facet arthritis is a common disease. Typically, patients have dull, aching pain in their neck. It's usually on both sides of the neck. The pain can go up towards the back part of their head or can go down their shoulders. It's usually worse with movements or activities, and it's better with rest.
I was having lots of pain, experiencing lots of pain in my right shoulder, my neck, and my shoulder blade. I played the keyboard for my church, and it was causing me problems to be able to last doing that, and to do housework and to function.
Miss Allen asked me to help her with her neck pain. She had it for a long time. She tried stretching exercises, she tried physical therapy, she tried different medications to help with her pain. Nothing made a gigantic difference. She had an MRI of her cervical spine of her neck, and it showed that she had significant arthritis and degeneration at several levels in her neck.
When I came in, we tried some medication first. and the pain did not get any better. It got worse instead.
When I saw her in the office, she had typical presentation of neck pain due to facet disease. At the time, we figured out which joints in her neck are the painful ones, and we did an outpatient procedure called facet joint steroid injections on her, where we injected some steroids and local anesthetic into the affected joints in her neck, and she did well.
Instead of doing any kind of surgery, I wanted to go this route first and study Dr. Farhat. So we did this first. It's been working, and there's no stiffness, no anything, so I've got the pain freedom.
It's been years since she complained to me about her neck. At the time, she quoted her improvement at more than 80–90%, and she's been fine since.
I'm very grateful because he has made it possible for me to have the strength that I have and to be able to go and do the things that I can do now that I couldn't do before. And it's made my life an extension of the things that I couldn't do, and I am very thankful. He has made it possible for me to have the pain freedom that I have.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. The Best Docs Network is all about amazing doctors changing people's lives. Like our next doctor, it's OB-GYN, Dr. Carol Norton.
One of the things that we do here at the Finer Touch is laser treatments for the skin that involve both what we call non-ablative, where no real downtime, you're doing something that's sort of on the surface of the skin and trying to promote a change underneath without actually affecting the surface. And then you can do procedures that
From the time I got there until the time I left was maybe 30 minutes. And that included the numbing time of the face and then the instructions at the end of the procedure.
Debbie's main concerns were wrinkles around her eyes and mouth. So she had a resurfacing procedure that focused a little bit more aggressively around the eyes and the mouth. And because those are smaller areas, we can actually be quite aggressive in those particular areas.
I would definitely recommend Dr. Norton and the staff at Finer Touch for not only laser resurfacing that I've had done, laser hair removal, and any of the procedures that they offer.
I see lots of patients who worry about hair loss. Men worry about that male pattern baldness. There's not a lot you can do about that. The medications we have, both pills and creams, work a little bit, but not great. Women, however, tend to have a problem where they go through these phases where their hair gets really thin, and that can be very, very anxiety-provoking. It is not unusual for the body and the hair follicles to go through phases where sometimes your hair will just be thin for months and months and months, and then it will reset itself. There's nothing you can do about that, really. Also, after you've had a real bad illness, for example, a high fever or some prolonged illness such as pneumonia, sometimes 3 to 6 months later, you, whether you're a man or a woman, may notice that your hair gets thin or you lose a lot of hair. That will be temporary. It's basically related to toxicity from your illness on your hair follicles, causing them to go into a temporary period of time that they don't properly grow. So don't look for all kinds of over-the-counter cures. It's mainly not going to help you. Just give it some time and it'll take care of itself.
Bunions are an angular deformity of the big toe. It causes a prominence which then rubs on shoe wear and often becomes painful.
When you develop a bunion, it's actually this part of the bone that becomes prominent, and the metatarsal starts to move inward, and the big toe actually starts to move towards the second toe.
There are various degrees of it, and they're often hereditary in nature. Contrary to popular belief, it's not from bad shoe wear, although certain shoe wear can obviously aggravate the condition.
Conservative treatment for bunions is limited to basically wearing shoes that have a wider toe box and allow for more room and less pressure of the area.
But often it requires surgical intervention. The surgery for it can vary. There are multiple different procedures to do. Typically what we'll do is take some digital x-rays on a patient and evaluate and discuss with the patient what is the best option for them.
Which involves basically shaving down the bump and moving a portion of the bone over and realigning the toe so that it sits straight once again.
There are other conditions that can affect the big toe, such as hallux limitus. That is an arthritic condition of the big toe joint.
This is different from a bunion in that the pain is located more on top of the toe joint as opposed to on the inside of the foot.
Those symptoms are usually with walking in higher heeled shoes. It's often how it starts. You can notice it squatting.
Every day, every step, it would hurt. And so now, 5 weeks post-op, I don't have the pain that I had just from walking down the mall. I'm really glad I did it.
Following surgery for hallux limitus, the patient will begin to experience a decrease in pain within 7 to 10 days and also an increase in range of motion at that big toe joint.
She actually told me that if I did not have it done, I'd end up with a fusion or a joint replacement. And a fusion means that you will never wear a high heel. It's like your toe is like straight, there's no bending it. That didn't seem like a good option. And who wants a joint replacement? I want my own joint.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to bestdocsnetwork.com.
Before I came in, my life was really kind of in shambles. I didn't know where I was going. I was hurt. I was in a lot of pain. Really numb. This was the last-ditch effort coming here to Lifeworks. I had been referred to Melanie Wells.
I had been working in a variety of different practices for years, and I'd worked alone, I'd worked alone in a group. I was really frustrated by the lack of collaborative input. One day I was driving along Lover's Lane and I saw some space, and I thought I just had this vision that I wanted to have a collaborative team to work on cases together. Collaboration for us involves complementary specialties. There are more than 20 people on staff, and we try to thin slice our specialties so that we're not competing with one another, we're working together as a team.
My first impression of Lifeworks was this is very different than the other therapist office that I had tried to go to. Not so clinical, not just very relaxed, very easy. The people were very easy to talk to. It made you feel very comfortable and welcomed.
I try to look at a case from every possible direction, and as the clinical director, I'm going around the room making sure that I hear from anybody involved in an area of that case that might have something to offer. I want to know what everybody else thinks about my cases. Having 20 people in the room that have 20 different points of view is extremely helpful to the clients and to all the therapists involved.
One thing I really like about coming here is that I kind of get more than one therapist at a time. They take the time and work together, may discuss my issues. It completely feels like I'm going to a friend that knows exactly what's going on to me. So easy to talk to.
We believe that therapy starts with the phone call. So when a client calls in, we want them to feel welcome and we want to be able to give them exactly what they need. Part of my vision for Lifeworks is to train therapists well, but also I want to be able to offer services to a wide range of individuals. I don't think money should ever be the reason not to come to therapy.
I don't even know how I would thank Melanie for what she has done for me. Words are not enough. It is invaluable what she has done. I love her to death. She's fun and just a really sincere person.
Don't forget, for more information on all the outstanding doctors you see on today's show that are helping change people's lives, head to the website, some great stories, and get to know the doctors as well as their patients. It's thebestdocsnetwork.com.
And now let's get to know our next doctor. It's oral surgeon, Dr. John Wallace.
Success rate of dental implants ranges about 97 to 99.5%. That's much better than what we used to do. The implant is placed in the bone. Notice it doesn't interfere with either of the adjacent teeth. After it heals in place and it's tested, place the abutment on top of the implant. I work with a team of dentists who then fabricate the crown that goes on top to make it look like a tooth.
I went in to have a basic procedure done at a dental practice, and pretty routine, and then found myself immediately needing to have the tooth removed.
Most people who want a tooth replaced are candidates for dental implants. And the reason they choose to move forward with that option is because the dental implant has a higher success rate than almost any other form of tooth replacement we know of.
I was actually able to have the tooth removed and the implant placed at the same time. Literally, he gave me the option to be sedated or just a local anesthetic, and so that's what I went with. Within, I'd say 45 minutes to an hour, he had the tooth removed and an implant placed. It was a lot less abrasive than I thought it was going to be. It was actually just like having a regular filling or a crown done at a dental office.
Dana came in and she had problems with an upper tooth for many years. They tried a filling, and they tried a crown, and nothing was making it better. So she finally said, well, we'll just take it out and place an implant. And I agreed to do that for her. We took the tooth out, we placed the implant, it healed in place for 3 months. She came back, we started to make the parts to go on top of it to make it look like a tooth again.
It seemed really seamless, and at that time it was pretty dramatic because I was going from a regular appointment to all of a sudden needing my tooth removed and an implant placed.
I think she had very little discomfort after the procedure. The procedure itself was very easy for her, and she's very happy to have a new tooth.
I would definitely recommend anyone that is needing any type of tooth replacement, be it multiple or single or whatever. The process was unbelievably easy.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
In spine surgery, one of the main surgeries that we've used has been the spinal fusion. The spinal fusion has been done for many years, and one of the things that we do with the spinal fusion is that we are trying to make two pieces of bone fuse together. Stem cell research has allowed us to create a fusion without taking actual bone tissue from the body. What that does, it makes it so that you don't have to have an additional incision and you don't have to deal with the postoperative problems that are associated with a bone graft. What we do to obtain the stem cells is we actually place a needle into the iliac crest rather than doing a large incision. We draw out the bone marrow that's rich in the stem cells, and then we take that and then spin it down. We then collect the stem cells and place that in the area where we want the fusion to occur with additional bone. What this allows is, or what this changes, is that we now don't have to make a big incision, which can be painful after the surgery or be deformed after the surgery. Once we've collected the stem cells from the iliac crest and we've concentrated them and spun them down, we will place them on a piece of bone like this. Basically, there's different types of bone that we use, and this is what we call cancellous bone graft. And then we'll place the stem cells in there and place this actually in the area that we want to fuse. This is a piece of allostem. This is stem cells that have been collected from fat cells and they've been placed inside a bone matrix. They're attached to actual pieces of bone. They come to us frozen in the operating room, and I take it and I thaw it out, and then I place this bone into the area where I want the fusion to occur. Now this has the stem cells impregnated in it, so these stem cells will actually turn into bone over time. This is called osteogenesis, or bone formation. Basically, the stem cell develops into a bone formation cell called an osteoblast. That cell then develops into an osteocyte, which is the mature cell. So basically what this stem cell does, it takes a lot of these cells and drives them toward forming osteocytes, which form the bone, which cause your fusion to occur. Our goal is to obtain pain freedom with stem cell technology.
For more information on all the outstanding doctors you see on today's show, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, it is time to head to our next best doctor. It's Dr. Paul Worrell.
I had no energy. I was limp. I just barely could put one foot in front of the other. Every day was just a difficult day to get through. All I wanted to do was just to crawl into bed. I was so tired. I was also having some heart palpitations and flutters, and that was scary. I could tell something was wrong. So I went and saw Dr. Worrell.
Sleep apnea is really sleep apnea with hypopneas. There are two different parameters we look at when we're doing sleep studies as far as sleep disordered breathing. There's the pause in the breathing for 10 seconds, which constitutes an apneic episode. In a hypopnea, you don't breathe well enough to get proper ventilation and your oxygen level actually drops. So for people who every 2 minutes don't breathe well enough to ventilate their body, then we call that a severe sleep apnea. Severe sleep apnea is associated with various kinds of heart problems.
Dr. Worrell suspected that I probably had a form of sleep apnea, and he prescribed a sleep clinic, and it came back that I was borderline. So we waited for a little while more and did another one, and finally it came back that I was full-blown sleep apnea. And they of course said, you've got to have a machine.
A CPAP is kind of a necessary evil sometimes. Some people will adapt more easily than others, and for those who do adapt to it, they are the ones who are the most appreciative because they see the quality of life improvement. They wake up and they're not so achy, not so stiff in the morning, that they have more energy, more stamina, that they just feel better overall.
Within 2 weeks of getting a good night's sleep with a CPAP machine, I was back to 100%. I was like, it's a miracle. It's just absolutely a miracle. I think Dr. Worrell is probably the best doctor I have ever gone to. He partners with you for your health issues. He's not condescending. He listens and very, very gently pushes you in the right directions that you need to go for your health.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
A little over 2 years ago, I was coaching my daughter's basketball team. Didn't like the way the drill that they were doing, so I kind of jumped in the middle of it and showed them how to do it. I'm not as young as I used to be. So the next morning I get up and I've got this severe back pain. And I thought, well, I just pulled a strain, something, it wasn't any big deal. A month later, I'm still in pain, thinking this is just really kind of strange. And we went and had an MRI done, and it didn't show anything that they could see.
Some very good doctors in the Metroplex had been taking care of him for a related problem of his hip. As I started examining him and talking with him, I realized that there was something going on in his hip joint itself.
He pulls the MRI up on the computer and says, yeah, we've got some kind of a tumor that had caused some weakening in the bones. There was a fracture one, there was a tumor, and it was an ugly mess.
It's one of those hip cancers that is eating away at his pelvis and eating away at his hip, and just weight bearing alone, walking, could cause a hip fracture, a pelvic fracture that could put him into extreme pain and extreme need for surgical intervention. Here's this guy who walked in on his own and who thought, well, I'm just getting another shot like I've always gotten, and now I'm telling him, you can't put any weight on this hip. You've got to go on crutches until further notice. You really need to go to MD Anderson. This is an MD Anderson type problem, and he did, and he went down there and he had surgery.
I went and had a hemipelvectomy, and they remove half of your pelvis out with an allograft. So they put somebody else's pelvis in me, gave me a hip replacement at the same time, 16 hours worth of surgery, 3 hours of plastic surgery. It was a pretty major ordeal.
He had to line in for an IV so he could get his chemotherapy, lost all of his hair, lost a lot of his weight, and just went through this journey that he didn't know if he was going to survive. I think he's the only 2-year survivor of this type of cancer without a recurrence that's known.
Combination of what the doctors do, hats off to Dr. Stevens, taking the first step to find my problem, get it diagnosed correctly, and then find the proper treatment.
Now he's back, family man, coach, dad, businessman, and back to himself again.
I had sinus pressure all in this area, all the way down to the jawbone, pain and swelling, and it wasn't just occasional, it was every day. I had been to about 8 doctors in the Metroplex. All of them had told me that there was nothing there, nothing they could do for me, and to basically go home, live with it, and for me that was not an option.
In Vicky's case, she presented to me with a history of constant headaches, chronic sinus disease, and had radiographic evidence of significant sinus inflammation. She had been treated with multiple rounds of antibiotics, nasal steroid sprays, and allergy medications with minimal relief.
My first appointment with Dr. James, he told me that he thought that he could cure me, that he thought that it was a balloon procedure that I needed. He explained that nothing is 100%. This might work and might not, but I feel like with your condition, that you've got a great chance, so it's up to you whether you go for it.
Usually on the first visit, we'll discuss their history, how much of their symptoms are related to actual sinus infections and sinus issues, and how much of those relate to just allergies. And then that kind of determines what type of further evaluation or diagnostic procedures we need to do. And
he did the procedure within 10 days. I was pain-free, have had absolutely no problems since. And as far as I'm concerned, he's a godsend.
Within 24 hours of completing the surgery, her headaches had resolved and symptoms had improved significantly.
Dr. James has changed my life for the better because the activities that I pursue, I'm able to do my gardening, my housework, just general things, travel, any activities I want to do with my grandchildren, running, riding bicycles. I didn't have the stamina to do that before. Now I'm able to do even more because I am pain-free.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that have helped change people's lives.
For more information on any of these great doctors you see on today's show, of course, you head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, we would love to hear from you. Send us an email at info@bestdocsnetwork.com.
And coming up next, it's the Best Docs Network featuring Forest Park Medical Centers, one of the top medical centers in the entire Dallas-Fort Worth area. Stay tuned and check that out. So long, everyone. We'll see you next week.
Bye.